The ER doors didn't open that night. They slammed like a breach charge. 3 Marines surged in with a gurney rainwater, and desert dust streaked across their boots, and a retired general bleeding out under torn gauze. Then the growl started, low, measured, final. A combat K-9 named Ranger planted himself at the bedside and dared anyone to come closer than 6 feet. Doctors froze. Security reached for steel. The monitors kept counting down anyway. And that's when a brand new nurse stepped out of the shadows and spoke a unit code this hospital was never meant to hear. The dog sat. The room went silent. If you've ever felt trapped between the rules and doing what's right, stay. Like the video and comment where you're watching from. That trapped feeling, that split second where the rules feel heavier than the person bleeding in front of you, does not start in a crisis. It starts in ordinary places under ordinary lights when nobody is watching you closely enough to notice what you are carrying. 7 days earlier, Tidewater County Medical Center looked like every other community hospital that served a working town. The parking lot was slick with salt mist off the Atlantic. The glass entrance smelled faintly of floor polish and old coffee. Inside, the air ran cold from vents that never rested, and the lobby television played a morning show no one listened to. At the front desk, a volunteer in a lavender sweater handed out visitor stickers with the gentle speed of someone who had done it for years. Claire Bennett walked in at 5:38 a.m., a full hour before her first shift was supposed to start. She did not drift or hesitate at the doors. She moved through them as if she had already been cleared to enter. Her scrubs were pressed, her badge clipped high on the chest pocket, her hair pinned tight enough that not a strand threatened her eyes. She carried a small tote bag that looked too light to hold anything important. Her shoes made no sound on the tile, not because she tried to be invisible, but because she had learned a way of walking that did not announce itself. The Human Resources office sat down a side hall behind frosted glass. A cheerful sign read, "Welcome new staff," in bright marker colors that did not match the muted hospital walls. Inside, a young coordinator named Tessa smiled too wide and offered Claire a pen attached to a plastic chain. "Claire Bennett, new RN for emergency," Tessa said, scanning her paperwork. "You're early." Claire's smile was polite, brief, almost practiced. Traffic's unpredictable. Outside, the roads were empty. Tessa flipped through forms. Vaccination records, license verification, direct deposit, a checklist of modules to complete. Claire's file looked almost insultingly clean, a stack of paper that said, "Competence," without saying anything else. She had an Illinois license, a nursing program listed in a suburb outside Chicago, a couple years at a small outpatient clinic. No gaps, no disciplinary notes, no personal statement. No story. "Cape Haven's a change," Tessa said, as she stapled something. "What brought you to North Carolina?" Claire lowered her gaze to the signature line. Her handwriting was neat and tight letters formed with control rather than flourish. "Fresh start," she said. It was not a confession. It was a boundary. Tessa nodded like she understood the way people did when they wanted to move on quickly. In healthcare, everyone assumed everyone else had something they did not want to say out loud. The difference was that most people wore their something in their face, in their jokes, in the way they sighed when the elevator doors took too long. Claire wore hers in silence. Orientation began in a basement classroom that smelled like dry erase markers and hand sanitizer. A nurse educator ran through policies with the tired enthusiasm of someone trying to keep new hires awake. The slides covered compliance, privacy documentation, infection control. Claire sat straight with her hands folded on the desk, eyes forward, listening as if the words were instructions that would be tested under pressure. When the educator asked the room any questions about workplace violence procedures, a few nurses chuckled. Claire did not. Her pen made a small mark on the page, then another, as if she were building a map instead of taking notes. Later, when they were shown the emergency department layout, the educator spoke about the obvious things. Trauma bays, supply room, medication dispensing, the safe room for combative patients. Claire followed the group and looked where everyone else looked, but her eyes also flicked to the corners of the hallway, to the doors that led to stairwells, to the badge access panels, to the security cameras mounted high and angled down. She did it so fast no one noticed. The ER sat at the back of the hospital, where ambulances could roll in without crossing the main lobby. The waiting room chairs were a tired shade of blue scuffed at the arms. A vending machine hummed against the wall beside a hand-painted sign offering free Narcan kits. Behind the triage window, the day shift charge nurse, Darla Stevens, moved with the brisk confidence of someone who had been shouted at by every kind of fear and anger and did not take it personally anymore. Darla looked up from her clipboard as the educator introduced the new nurse. Claire Bennett. Darla repeated, eyes narrowing in quick assessment. "You ever worked ER?" A little, Claire said. Darla's mouth twitched, not quite a smile. "A little is either nothing or everything. You'll learn fast." Marisol Park met her in the hall, an older nurse with steady hands and a voice that never seemed to change volume. Marisol had spent years in ICU before transferring to ER for something she called a different kind of tired. She wore her badge lanyard like a badge of rank. "Stick near me," Marisol said, then added, "unless you're the type that runs." Claire glanced at her just long enough for Marisol to read her eyes. "I don't run," Claire said. Marisol's gaze stayed on her a moment longer. It was not curiosity. It was calibration. The first shift was mostly small chaos. A toddler with a fever that had parents crying like it was the end of the world. A man with chest pain who swore it was heartburn until his sweat turned gray and his EKG proved him wrong. A woman who came in for ankle pain and left with a diagnosis she did not want. Claire did what new nurses were supposed to do. She followed protocol. She asked questions when she needed to. She stalked rooms without being asked. She learned where the trauma carts were kept and how the drawers were organized. She memorized where they stored the pressure bags, the chest tube kits, the intubation blades, the blood tubing. She moved like someone trying to make the department run smoother without making herself visible. At 11:12 a.m., a commotion rose near triage. A patient in the waiting room stood up fast, knocking over a chair, yelling at the receptionist. The words were slurred, angry, full of accusation. The receptionist stiffened. Darla's voice stayed calm, too calm, the way staff learned to speak to someone who might swing. Claire's head turned before anyone called security. Not sharply, just enough to see. The security officer on duty, Calvin Dorsey, appeared at the end of the hall, like he had been waiting for the sound. He was built like a man who had once worn a uniform and now wore a hospital polo as if it were a compromise. He stepped in between the patient and the desk, with his palms open. His voice was low. "Sir, let's talk. Over here." The patient's eyes jumped, his breathing fast. For a second, it looked like he might explode. Claire watched the distance between Calvin and the patient, the angle of Calvin's body, the way his weight stayed balanced on the balls of his feet. Calvin guided the man toward a quieter corner, still speaking, still calm, still ready. When it was over, Darla exhaled through her nose and shook her head. "That's Cape Haven," Darla muttered. "Some days it's beach tourists. Some days it's this." Marisol caught Claire's face. "You didn't flinch." Claire returned her gaze to the supply cart. "It wasn't my patient." Marisol made a soft sound, not agreement, not disbelief. "That's not why people flinch." Later, during a brief lull, the nurses gathered in the break room. The room was too bright and too small, the smell a mix of microwaved leftovers and burnt coffee. Someone had left a half-finished donut in a box on the counter, now hard at the edges. A tech named Jonah told a story about a drunk guy who had tried to bite him last week. The room laughed in a tired way. Someone asked Claire where she was from. Someone else asked if she had family here. Claire ate quickly, methodically, the way she did everything. She kept her eyes down on her food. When she looked up, it was only to respond and then look away again. "Midwest," she said when asked. "Just moved." "What brought you here?" Jonah asked. "Fresh start," Claire said again. The words landed and ended the conversation without drama. People accepted it because it was easier than pushing. In hospitals, you learned quickly who wanted to talk and who needed silence to keep functioning. When the shift ended, Claire stayed 10 minutes after clock out to restock Trauma Bay 2 without being asked. She wiped down a counter as if it mattered. She checked the suction canister levels. She made sure the airway cart was sealed. Darla walked past and paused. "You're off." Claire did not stop moving. "I'm almost done." Darla studied her like she was reading between lines. "Don't make a habit of working for free." Claire met her eyes. "It's not free. It's preparation." Darla's gaze held, then she looked away, unsettled in a way she would not name. On the second day, Claire learned the rhythm of the department. The way the phones rang in clusters. The way the ambulance radio crackled with urgency. The way the staff moved faster without ever calling it panic. On the third day, a motor vehicle collision came in. 2 patients, one stable, one not. Blood on the sheets. A man staring at the ceiling as if he could not believe his body had failed him. Marisol barked orders a tone that left no space for doubt. 2 large bores. Type and screen. "Get me fluids." "Claire, monitor." "Stay with me." Claire's hands moved without trembling. She placed leads. She adjusted oxygen. She spoke to the patient in a voice steady enough to borrow calm from. "You're in the hospital," she said. "You're not alone." The man's eyes flicked toward her. He gripped her wrist, desperate. "I can't breathe." Marisol leaned in, listening, assessing. Claire watched the rise and fall of his chest, the effort, the shape of the breaths. She did not say anything at first. She waited until she was sure. "His left side," Claire said quietly. Marisol glanced at her. "What about it?" "Breath sounds. They're lighter. He's compensating." Marisol's eyes narrowed, not offended, just suddenly focused. She listened again. "Get a portable chest X-ray." Darla heard it and moved. The room tightened into action. The X-ray showed a small pneumothorax. Not the dramatic kind. The kind that could become dramatic if someone missed it. Marisol looked at Claire after the patient was stabilized. "How'd you catch that?" Claire cleaned her hands. "His breathing pattern." "That's not an answer," Marisol said. Claire's gaze did not change. It didn't look right. Marisol studied her face again, searching for the telltale signs of a new nurse trying to sound confident. Claire offered none. There was no pride, no performance. Just a simple statement as if she were describing a fact. After that, the staff began to notice small things without realizing they were noticing. The way Claire seemed to remember everyone's name after hearing it once. The way she asked the right question at the right time, never the ones that wasted air. The way she did not complain about night shifts or weekends or being floated. When a nurse called out sick, Claire volunteered. When a resident fumbled for an instrument, Claire's hand was already offering it. She made herself useful. She made herself quiet. At home, her apartment was sparse. A couch, a small table, a lamp. Curtains drawn tighter than necessary. The walls were bare. Her suitcase still sat in the corner, as if she did not want to admit she lived there yet. In the bedroom closet, a shoebox rested on the top shelf behind folded towels. Inside were a few things wrapped in cloth, a coin worn smooth, a dog tag chain without tags, a patch with a symbol most civilians would not recognize. Claire never opened the box while the sun was up. At night, sometimes she would stand in front of the closet door and keep her hand on the handle without pulling. She slept light. She woke easily. The ocean wind rattled the window frame sometimes, and her eyes would open instantly, heart already moving faster before her mind caught up. On the 5th day, Marisol found Claire in the supply room sorting IV start kits by size and expiration date. "You don't have to do that," Marisol said. Claire did not look up. "Someone should." Marisol leaned against the door frame. "You're not trying to impress anyone, are you?" Claire's hands paused for half a second. Then they continued. "No," she said. "I'm trying not to make mistakes." Marisol's voice softened a fraction. "You make it sound like mistakes are fatal." Claire slid a box into place. "Sometimes they are." Marisol did not push. She did not say she understood. She only nodded slowly as if she had seen enough death to accept other people's relationship with it. Tidewater County Medical Center served the people who lived between the base and the coast. Fishermen who came in with hooks in their hands. teenagers who wiped out on skateboards, tourists burned red from sun and liquor, retirees with brittle bones and stubborn pride. The base was close enough that Marines came in occasionally, usually for training injuries, dehydration stitches. Sometimes an older veteran arrived with a chest full of medals and a face full of silence. Most nights, the ER moved in patterns everyone recognized. Even when it was busy in familiar ways. Dr. Evan Mercer liked familiarity. He did not say it out loud, but it showed in the way he ran the department. He was mid-40s, hair always neat sleeves, always rolled to the same spot on his forearms. He spoke in calm sentences even when things were ugly. He trusted protocols because protocols were built to catch human error. He believed that if you followed the steps, you could outrun chaos. He was not wrong often, which is why the staff followed him. When Claire worked with him for the first time, she watched the way he moved, the way he kept his hands low, the way he centered himself at the foot of the bed, the way his voice was steady enough to anchor the room. After a patient coded and was brought back, Mercer pulled his gloves off, breathed once, then turned to the team. "Good work," he said. "Chart clean. Debrief in 5. The room relaxed. Nurses released breath they did not realize they held. Claire did not relax. She began restocking the crash cart again, fingers moving as if the code had never ended. Mercer noticed. His eyes flicked to her badge. "Bennett. You're new," he said. "Yes, doctor. You handled that well. Thank you." Mercer paused, studying her. "Where'd you learn to stay calm like that?" Claire's gaze held his for a beat, then shifted politely away as if she were choosing her words from a small, controlled list. "I get quiet when things get loud," she said. Mercer nodded, accepting it, but his expression suggested he did not fully. By the 6th day, the ER staff had formed an opinion of Claire that was not quite a story yet. They called her competent. They called her reliable. They called her reserved. They did not call her warm, but they did not call her cold either. She was simply there, always ready, always present, like a tool you were grateful to have in your hand. That night, Marisol sat beside Claire during a short break and watched her stare at the wall without looking at anything on it. "You ever miss home?" Marisol asked. Claire blinked once. "I don't know if I had one." Marisol held her gaze. "That's a heavy answer for a Tuesday." Claire's mouth tightened slightly, then softened. "Sorry." "Don't apologize," Marisol said. "Just don't lie to me. If you need space, say it." Claire's eyes lowered. "I'm fine." Marisol's expression did not change. "That's a lie. It's also a common one. I'll accept it for now." Claire gave a small nod. It was the closest thing to gratitude she offered. On the 7th day, Claire's schedule put her on night shift. The ER at night felt different. The same rooms, the same machines, but the shadows seemed thicker around the edges. The hallway lights were dimmed slightly. The building hummed in a lower register. Outside, the wind pushed rain against the ambulance bay doors in steady bursts. Claire arrived early again. She walked past the waiting room, now half empty, and checked the board. She read the names. She read the triage levels. She read the room assignments. Then she looked up at the exits without appearing to. Darla greeted her with a tired wave. "Welcome to the real show." Marisol was already there, coffee in hand, eyes tired but focused. "You good?" she asked. Claire nodded. "Yes." Marisol watched her for a second, then handed her a pair of trauma shears from the supply bin. "Keep these. The ones in the rooms disappear." Claire took them, turning them once in her hand as if weighing more than metal. At 1:07 a.m., the ER was steady, not quiet. Steady. A drunk man slept in the corner of a bed with a curtain half closed. A teenage girl with a sprained wrist scrolled on her phone, eyes glassy with pain, but trying not to show it. A middle-aged woman waited on labs, tapping her foot, irritated that the world did not move faster for her. Claire moved between rooms, charting checking vitals, answering call lights. She spoke gently to a man who was embarrassed about his symptoms. She apologized to a woman who was angry not because she deserved it, but because apology sometimes lowered the temperature of a room. At 2:19 a.m., a loud bang echoed from somewhere down the hall. A cartwheel clipped a doorway. Someone cursed softly. A normal sound. Claire's head turned instantly anyway, her eyes narrowed, assessing. Marisol noticed and said nothing, only took a slow sip of coffee, as if filing the information away. At 2:41 a.m., the ambulance radio crackled. Darla leaned into it, listening pen poised over the clipboard. The voice on the radio was tense, clipped. Inbound. Priority trauma. 2 minutes. Darla's posture tightened. Copy! She hit the overhead. Her voice carried through the ER with the authority of someone who had done this too many times to panic. Trauma team to Bay 1. Trauma team to Bay 1. The words shifted the air. People moved faster. Voices dropped. Machines were checked. The trauma bay lights snapped brighter. The room smelled sharper, antiseptic and plastic. Claire stepped toward Trauma 1, with Marisol hands, already gloved eyes scanning the bay, the way she had memorized it. The ventilator stood ready. The monitor cables were coiled. The suction was tested. The crash cart seal was intact. Blood tubing was hung. The room waited like a held breath. Dr. Mercer appeared at the bay entrance, pulling on his gown, calm face set. "What do we have?" he asked, though no one knew yet. Darla looked down at her radio again, listening for details, but the line crackled with only rushed voices and the low wail of sirens. Claire stood at the edge of the trauma bay, shoulders squared, breathing slow, watching the ambulance bay doors as the first set of headlights swept across the wet glass outside. The first set of headlights swept across the wet glass, and the ambulance bay doors shuddered as something heavy hit them from the outside. They did not slide open with the careful pace the staff expected. They flew wide, catching the wind, slamming against their stops with a metallic crack that echoed down the corridor. The sound ran through the ER like a warning bell. 3 Marines came through first, not walking so much as taking the space. Their boots struck the floor in a tight rhythm, practiced deliberate. Desert camis still carried dust in the seams, and rainwater streaked down their sleeves as if the night could not decide which world they belonged to. Their faces were hard-set and young in a way that did not match the look in their eyes. Behind them, a gurney surged forward, its wheels squealing as they fought the turn onto polished tile. A corpsman rode the side rail, one hand locked on the frame, the other pressed into a soaked compression dressing. His gloves were glossy with blood. "Trauma 1. Darla called, voice sharp. "Clear the hall." People moved. A tech grabbed the waiting room divider and pushed it back. A nurse pulled a family member out of the corridor by the elbow. The atmosphere tightened the way it did when the department stopped being a place where you treated patients and became a place where you fought time. The patient on the gurney looked like a man carved out of stubbornness, even unconscious. Broad shoulders under a shredded blouse of uniform skin gray at the lips, eyes shut, jaw clenched as if he was still holding rank in his sleep. A patch of white hair was matted with sweat at his temple. Gauze wrapped his shoulder and abdomen, but blood had already found its way through in ugly blooms. The corpsman did not look up as he rattled off numbers. Pressure 80/40, pulse 135. He's cold. He's fading. Dr. Mercer stepped into the hall at the sound gown flapping behind him, hands already gloved. His calm had edges now. "Name," he said. One of the Marines answered without missing stride. "Major General Richard Knox. Retired. Medical evac from base perimeter." Mercer's eyes flicked over the uniform, the shape of the man, the way the Marines moved around him, like a perimeter made of muscle and loyalty. He did not waste time asking why a retired general was coming through his doors like this. He pointed. "Trauma 1. Move." They hit the corner, the gurney fishtailed, and that was when the other sound rose through the noise. A growl. It was low enough at first that it felt like vibration more than audio, a thread of warning braided through the chaos. Then it deepened, took shape, became undeniable. Not panic, not confusion. Control. Claire felt it in her ribs before she fully registered what she was hearing. The dog appeared at the foot of the gurney, like he had been there the entire time, and everyone had simply failed to notice. A German shepherd, thick through the shoulders, eyes bright and locked forward. Tactical vest snug against his chest, paws placed with purpose. Every inch of him was discipline held under tension. A name patch sat across his side in block letters. Ranger. He walked in step with the gurney, head low gaze shifting, reading faces and hands and distance like a second language. The Marines did not touch him. They did not need to. They moved the way people moved around a weapon that was already armed. The second they crossed into the main ER corridor, Ranger surged half a step forward, placing himself closer to the patient's torso, as if his body could shield the gurney from the entire building. The growl rolled out again, steady as a drumbeat. A resident blurted, startled, "Do not move on him." The corpsman snapped, still working fingers pressing into the dressing to slow bleeding that did not care about conversations. "He is working." Mercer's eyes narrowed. "I need access to the patient." One of the Marines, the tallest, stepped close enough for Mercer to see the name tape remembered in the hook of his memory. Hale. Staff Sergeant Mason Hale did not raise his voice. He did not need to. "You're not getting near him until Ranger stands down." Mercer walked alongside the moving gurney anyway, matching their speed. "Your general is hypotensive and he's bleeding out. We cannot treat him from the hallway." Hale kept his eyes forward. "Ranger will bite if you reach. Then move the dog." Hale's jaw tightened. "Not your call." They reached the trauma bay doors and Darla held them open. The team inside had been ready, lights, bright equipment staged, but the moment the gurney crossed the threshold, the flow snapped. Ranger planted himself at the bedside like a gate locking shut. The trauma bay suddenly felt smaller. The hum of monitors, the hiss of oxygen, the squeak of shoes on tile, all became background to the space Ranger claimed. His body formed a barrier between the general and every hand reaching for him. Marisol stepped toward the gurney with a blood pressure cuff in her hand. Ranger's head whipped, teeth flashed, and he lunged just enough that Marisol felt air shift at her wrist. He stopped a breath away, not because he was unsure, but because training told him exactly where the line lived. Marisol froze, muscles hard, eyes wide for half a second before she forced her face back to neutral. "Okay," she said quietly to no one and everyone. "Okay." A tech instinctively stepped back. A resident cursed under his breath. The room's energy went from controlled urgency to brittle standoff. Mercer lifted his hands slowly, palms visible. "Easy," he said, voice low. "Ranger, we're here to help your handler." Ranger did not respond to the words. His eyes stayed on Mercer's hands, reading intent through motion. The corpsman spoke without looking up. "He is not going to recognize you. He only stands down for his chain." Mercer's gaze flicked to Hale. "Then give him his chain." Hale's eyes flashed. "His handler is on the gurney." Mercer's mouth tightened. "Then you need to get him out of the room." Hale stepped closer to the gurney. Ranger did not growl at him. Ranger did not even look at him. His trust was not general. It was specific. The corpsman's voice sharpened as he read the monitor. "Pressure is dropping. 75/38. He's going." Darla moved to the wall phone and stabbed a button. "Blood bank activate massive transfusion protocol. Trauma 1. Now." A voice crackled back. "Copy?" Mercer glanced at the team, then back at the dog. His expression stayed calm, but the muscles at his jaw flexed. Sedation, a resident suggested, too fast, too eager to solve the dog problem like it was an IV line. Hale's head snapped toward him. "No, it's a dog," the resident said, defensive. "It's a working dog," Hale corrected. "And you're not drugging him." Calvin Dorsey's security had slipped into the doorway, drawn by the noise. His eyes took in the Marines, the blood, the dog, and the way the room's balance was one wrong move from breaking. He spoke carefully. "Sir, hospital policy says animals cannot interfere with treatment." Hale turned eyes hard. "He's not an animal. He is a combat asset." Calvin's shoulders lifted slightly, a reflex of someone who had spent time around men who used language like that. "I get it. But if he bites staff, I have to act." The air changed. It did not take a raised voice or a weapon drawn. It was the way the Marines' posture shifted, subtle, like doors closing in their minds. Hale's tone went flat. "If you act, you are acting on us." Calvin's hand drifted not to threaten, but to remind himself where his equipment sat. The leather of his holster creaked. Ranger's head turned toward the sound. His growl deepened, not louder, heavier. A warning that did not need translation. The corpsman did not stop working. He pressed harder into the dressing, then shouted numbers that felt like a countdown. Pulse 140. He's losing it. He needs surgery. Mercer took one measured step toward the gurney. Not fast, not aggressive, but purposeful. Years of emergency medicine told him proximity meant control, that hands on a patient could pull them back from the edge. Ranger exploded. He launched forward with terrifying speed, jaws snapping through empty air and stopping less than an inch from Mercer's gloved hand. Mercer felt heat, breath, the unmistakable power of an animal that knew exactly how to end a movement. The room froze in a single shared flinch. Mercer did not jerk away. He held still, eyes locked on the dog breath, steady. "Good," he murmured. "Good boy. Easy." Ranger's teeth remained visible. His eyes did not soften. His body stayed coiled, ready to strike again without warning. Hale's voice cut through the stillness. "Do not test him." Mercer's gaze flicked briefly to the monitor. The numbers were ugly. A patient could die with an entire team standing 2 feet away, unable to touch him. Mercer turned his head slightly, speaking to Darla without taking his eyes off Ranger. "Can we clear the room?" he said. "Get non-essential staff out." Darla nodded once, then pushed people back. "Out. If you're not hands-on, get out." The trauma bay emptied to a core group. Mercer, Marisol, Darla, a resident, the corpsman, Hale, and 2 Marines. Calvin stayed in the doorway, tense, as if leaving would be abandoning the line he was responsible for. Claire stood outside the bay for a moment, watching through the glass panel in the door. The lighting inside made the blood look almost black. The sound of the monitor beeped with uneven insistence. Her heartbeat stayed steady, but her mind sharpened. Ranger's placement was precise. He stood at the general's side, angled to cover the chest and abdomen, blocking the path of any hand that moved toward the torso. His ears tracked every sound. His gaze moved between faces and hands, and the general's body, constant surveillance. Ranger was not confused. He was executing a mission. Claire had seen that kind of focus before, in people and in animals. She recognized what triggered it. Handler down. Threats close. No clear authority presented. Authority was not a title in that moment. It was a signal. Darla cracked the door open enough to speak. "Claire," she whispered, urgent. "Stay back." Claire did not respond right away. She watched Mercer's hands. She watched the corpsman's. She watched how the Marines positioned themselves. She watched Ranger's line. Marisol glanced toward the door, eyes catching Claire's face. "Bennett," she said, sharper. "No." Claire stepped inside anyway. Her shoes made almost no sound. Not because she was trying to be stealthy. Because she was calm enough not to stomp her fear into the floor. The room noticed her movement the way it notices a change in pressure. Heads turned. Mercer's eyes flicked toward her with irritation and relief tangled together because any new variable could either save them or destroy them. Hale's gaze snapped to her, assessing, confused. "Ma'am," he said, voice controlled. "You need to back up." Claire kept walking. Not rushed, not hesitant. Deliberate. She stopped a few feet from Ranger, outside the invisible perimeter the dog had claimed. She did not raise her hands high. She kept them visible at her sides, relaxed. She did not stare Ranger in the eyes the way civilians did when they were trying to show confidence. She let her gaze pass over him, acknowledging without challenging. Ranger's ears twitched. His growl did not increase. He studied her. Claire lowered herself to one knee with smooth control, her movements economical. The posture was not a plea. It was a signal in itself. A way of taking height out of the equation without surrendering intent. Hale stepped forward half a pace. "Ma'am." Claire spoke before anyone else could. The words were quiet, clipped and delivered with a cadence that did not belong in a civilian trauma bay. Raven 6 down. For a fraction of a second, nothing happened. The monitor kept beeping, the fluorescent lights kept buzzing. The corpsman's hands kept pressing blood back into a body that did not want to keep it. Then Ranger froze. The growl stopped mid-vibration like someone had flipped a switch. His ears came forward. His head tilted slightly as if he were listening for the rest of the command that never came. His posture changed. The tension drained in a visible wave muscles, unlocking weight, shifting from attack ready to standby. He glanced down at General Knox, then back at Claire, and the look in his eyes was not obedience to a stranger. It was recognition. Ranger sat, slow, controlled, deliberate. His weight settled beside the gurney head, lowering until it rested gently against the general's side. A guardian returning to watch rather than fight. 3 seconds passed where no one moved. Mercer's voice came out rough. "How did you—" He did not finish. The sentence had nowhere to go that made sense. The corpsman looked up for the first time. His eyes moved from Ranger to Claire, like he was seeing her clearly for the first time, and did not like what it implied. Hale stared, not hostile now, but sharp, with a different kind of attention. "Who are you?" he asked. Claire did not answer him. She stood still, calm, and reached toward Ranger's collar. Not gripping, not pulling, just resting her fingertips there as a point of contact. Ranger rose at once, steady. Claire spoke to Mercer. "You have access. Now." Mercer snapped back into motion like a man released from a trap. "Okay. Airway breathing circulation. Let's move." The room surged. Marisol stepped in first, placing the blood pressure cuff moving with quick precision. The resident moved to the head of the bed, checking airway. Darla pulled on a new pair of gloves and lifted the sheet to expose the abdomen. Mercer's hands were on the general's chest within seconds, palpating, assessing voice returning to command. 2 large-bore IVs. "Start blood. Get me a fast exam. Labs type and cross. Let's go." The corpsman rattled off again, now louder, urgency unchained. Shrapnel to shoulder and abdomen. Possible blast concussion. He was conscious for 5 minutes, then dropped. Mercer nodded. Mechanism noted. Claire stayed near Ranger's shoulder, not interfering but present. Ranger's eyes tracked every hand that touched the general, but he did not react. His trust stayed fixed on Claire like a tether. Marisol glanced at Claire, breath tight. "What did you say to him?" Claire answered without looking away from the monitor. "A command he recognizes." Marisol's eyes narrowed. From where? Claire's voice stayed neutral. "It doesn't matter right now." Mercer did not argue. He did not have time. His focus was on the body in front of him. General Knox's skin was cool. His pulse thready. His chest rose and fell like it was arguing with gravity. Blood seeped from under the bandage at his abdomen, slow and relentless. "Pressure," Darla called. 72/35. Mercer's tone sharpened. "Hang blood. Warm fluids. Get the level 1. A tech ran out. The blood bank cooler arrived with a clunk a minute later. Darla cracked it open, hands quick, and began spiking units. The resident at the head of the bed leaned in. "He's protecting his airway. Breathing rapid. SAT is 91. Mercer's eyes flicked to the monitor. "Keep him oxygenated. Get a chest X-ray." The resident hesitated. "Dock the abdomen." "I know," Mercer said. "We can't ignore the chest." Hale stood at the foot of the bed, eyes scanning the room, jaw clenched. He did not interfere now. He watched like a man who had been trained to observe threats, except his threat was time and bureaucracy, and anything that might pull this patient away from care. Calvin shifted in the doorway. The bite risk had evaporated, but the tension remained because now the questions had teeth. Mercer glanced toward Claire, his eyes sharp. "You're staying with the dog." Claire nodded once. Hale took a step closer to her, lowering his voice so it did not carry. That phrase, Raven 6, that's not something you pick up in nursing school. Claire kept her eyes on the general. "Then focus on him." Hale's gaze hardened. "I am focused. I'm also paying attention." Claire did not respond. The portable ultrasound arrived. Mercer grabbed the probe, gelled it, and pressed it to the general's abdomen. The screen flickered with grainy black and white shapes. "Free fluid," Mercer muttered, voice tightening. "Positive, he's bleeding." Darla's face set. Mercer nodded. "Call surgery. We need a trauma surgeon now." A nurse on the phone spoke rapidly, relaying details. The room moved in overlapping tasks, each person snapping into their role, now that Ranger was no longer the barrier. Claire watched it all without getting in the way. Her eyes moved continuously, not frantic. Monitor. Chest rise. Hands on abdomen. Color of the lips. The rhythm of breathing. The general's oxygen saturation dipped again. 90, 89, 88. The resident adjusted the mask. He's not improving. Mercer's brow furrowed. Increase flow. Marisol listened to breath sounds stethoscope pressed to the general's chest. Breathing sounds are there. Hard to hear with the chaos. Mercer did not like hard to hear. He liked clear answers. X-ray, he snapped. The portable machine rolled in plate, slid under the general. The tech took the image and wheeled out, moving fast. Darla's voice cut in. Pressure 68/30. Mercer swore softly, then steadied his tone. Give TXA. Push blood. Prepare for intubation if he drops. The corpsman leaned in, voice tight. He won't survive the weight. Mercer met his eyes for a beat. Neither of us wants him to. Hale's attention shifted back to Ranger for a moment. The dog lay at the general's side, head up, watching. When Mercer's hands pressed down on the abdomen, Ranger's ears flicked, but he stayed still because Claire's hand remained on his collar. Claire felt the dog's tension like a current under her fingertips. You're doing good, she murmured, barely audible, not for the room, for Ranger. Ranger's gaze flicked toward her, then back to the general. The chest X-ray image arrived on the screen near the bed. Mercer studied it quickly, eyes scanning for obvious collapse, obvious deviation, obvious catastrophe. The picture was imperfect, taken under pressure, patient not positioned ideally. Mercer's mind moved toward the abdomen because that was the loudest problem. The ultrasound had proven bleeding. Surgery was the next step. A trauma surgeon called from upstairs, voice on speaker. We're ready to receive. How unstable? Mercer answered immediately. Very. Positive fast. Hypotensive despite blood. We're bringing him. Hale's shoulders eased a fraction at the word bringing, as if movement towards surgery meant progress. Darla began disconnecting lines for transport. Marisol looked at the general's face, then at Mercer. He's tiring. Mercer nodded. Let's move. Claire's eyes stayed on the monitor. Oxygen saturation dipped again, then bounced slightly, then dipped. The breathing pattern looked wrong. Not just fast. Uneven. She watched the general's chest. The rise was there, but it looked strained, like one side was doing more work than the other. She watched the way his ribs moved, subtle, not dramatic, but enough. Her mind reached back into muscle memory she did not speak about. The kind of injury that did not announce itself with blood. The kind that killed quietly while everyone chased the obvious wounds. Mercer spoke again, voice firm. On 3 we roll. The team positioned hands on the sheet and the rails. Ranger's head lifted slightly, ears forward, reading the room's intention. Claire tightened her fingers on his collar, not pulling, just anchoring. Hale stepped closer, ready to move with the gurney. The general coughed once shallow, then his oxygen saturation dropped a full point like a warning. Claire's voice cut through the movement, calm but undeniable. Dr. Mercer. Mercer paused, eyes snapping toward her. What? Claire did not raise her voice. She did not dramatize. She simply looked at the general's chest, and then at Mercer. Before you move him, she said, listen again. Marisol's gaze flashed to Claire, startled. Mercer's jaw tightened. We don't have time for delays. Claire met his eyes, and for the first time since she walked into this hospital, something in her expression suggested a different kind of authority. Not rank, not ego, certainty built on experience. Take 10 seconds, she said. Mercer held her gaze for a beat, then turned back to the patient and pressed his stethoscope to the general's chest, listening with sharper focus. Marisol leaned in on the other side, listening too. The monitor beeped, unevenly steady in its insistence. In the quiet of that 10 seconds, with everyone holding still around a dying man, the sound in the room changed. Not the monitor. The breathing. It was there, but it was not balanced. Mercer's eyes narrowed as he listened. Claire's hand stayed on Ranger's collar. The dog remained still, watching Mercer's hands like he understood this was the moment that mattered. Mercer lifted his head slightly, eyes flicking toward the oxygen saturation, then back to the chest as if the pieces were trying to align in his mind. He inhaled, once slow, then spoke, voice lower now. Tell me what you're hearing, he said, not to the room, to Claire. Mercer steadied his hands the way he always did, before a procedure, not by thinking about perfection, but by narrowing his world to skin angle and timing. The general's chest rose. In shallow bursts, the monitor chirped like a metronome that had lost its patience. Left side. Mercer said, voice low. Mark it. Marisol's fingers found the space between ribs with quick certainty. Here. Ranger's eyes tracked the movement, bright and unblinking. His body did not move, but Claire felt the tension under her fingertips tighten like a drawn cable. She kept her palm where it was light contact, steady presence. Hold, she murmured, barely sound. Ranger's ears twitched toward her voice, then returned to the hands near his handler. Mercer cleaned the skin fast. The antiseptic smell bloomed sharp and cold. The resident hovered at the head of the bed, swallowing hard, glancing between the oxygen saturation and Mercer's hands. Sat is 83, the resident said. Mercer did not look up. Keep him oxygenated. He positioned the needle. The room seemed to lean toward him. Even Hale, rigid at the foot of the bed, stopped breathing for a beat. Mercer pressed in with controlled force. Skin gave then resistance, then a sudden release. A hiss cut through the room like air escaping a tire. The general's chest moved differently, almost instantly, not bigger, but freer. The monitor numbers did not jump in celebration. They climbed like a body being allowed to stop fighting itself. 84, 86, 88. Marisol's shoulders dropped a fraction, a tiny surrender to relief. Good, Mercer said. And for the first time, his voice carried something like gratitude. Not spoken to anyone, just released into the room. That's it. The general coughed again, shallow, then his breathing eased enough that the resident's jaw unclenched. Ranger lifted his head, higher nostrils, flaring eyes fixed on the general's face. His body remained in place. The growl did not return. Claire felt the dog's tension shift from attack readiness to alert, watchfulness. Pressure. Darla called, voice tight, but steadier. 74/39. Coming up. Mercer secured the needle and turned toward Darla. Chest tube kit. We need a definitive fix. Darla already had the tray open. She moved with the sharp efficiency of someone who had done this under worse circumstances. The plastic wrappers cracked open. Metal instruments clinked. Suction tubing uncoiled. Hale watched all of it like he was watching a bomb being disarmed. Doc, he said, voice low, trying to keep control with tone alone. Can you move him now? Mercer's eyes flicked to the monitor and back. Not yet. Hale's jaw tightened. He needs surgery. Mercer nodded once. He is getting it. After, he can breathe. Price the corpsman finally let his hands ease pressure for a second to adjust the dressing. His gloves were slick. His eyes were tired, but there was a sharp edge of respect forming there, now pointed directly at Claire. You called it, he said quietly. Claire did not answer him. She watched Mercer's hands, watched the general's chest, watched Ranger's eyes. Mercer leaned in, careful, moving slow enough that Ranger's trust did not fracture. Claire kept her hand on the collar as a quiet bridge between dog and room. Ranger, she said softly. Not a command more, a reassurance. Easy. The dog's gaze flicked to her, then back to Mercer. He stayed. Mercer made the incision with practiced speed. Blood welled bright and immediate. Marisol suctioned. Darla handed instruments without being asked. The resident's voice at the head of the bed steadied as he found his role again. Sat 91. Mercer worked through tissue layers with controlled force, then the subtle give that told him he was where he needed to be. Tube, he said. Darla placed it into his hand. Mercer guided it in, then secured it. The suction engaged with a sudden pull. A deeper hiss followed, then a wet release air, and fluid finding the path out of a space that had been tightening toward catastrophe. The general's chest rose more evenly. His breathing slowed by degrees, not normal, but no longer desperate. The oxygen saturation climbed again. 93, 95. The monitor beeped in a steadier cadence, less erratic, like the body had found a rhythm it could hold. Marisol let out a breath she had been sitting on since the Marines hit the doors. There, she said almost to herself. Mercer's eyes met Claire's for a brief second. His expression was still hard with focus, but the question behind it had sharpened into something else. He did not ask it. Not now. He turned back to the patient. Okay, we move. Darla was already disconnecting and reconnecting lines for transport, securing tubing, checking labels, calling out tasks like she was keeping the room stitched together. Blood running, chest tube secured, monitor portable on. The trauma surgeon's voice came again on speaker impatience edged with concern. Status. Mercer answered without hesitation. Left tension relieved. Chest tube placed. Hemodynamics improving. We are bringing him. Now, the surgeon said. Now, Mercer echoed. Hale's shoulders eased as if someone had removed a weight from his spine. He leaned close to the gurney, eyes on the general's face. Stay with me, sir. He muttered a line meant for battlefields, not hospital lights. Ranger rose smoothly as the team prepared to roll, but he did not block hands anymore. He stayed tight to the gurney body, aligned with movement, eyes scanning. The dog did not take his cue from the room. He took it from Claire. Claire walked at Ranger's shoulder, one hand resting on his collar, not pulling, not guiding, simply present. When the gurney started moving, Ranger moved with it like a shadow that had been trained to be solid. They cleared the trauma bay doors into the corridor. The fluorescent lights stretched long overhead. The hospital at night felt suddenly smaller under the weight of what it had just held. Staff stepped back as they passed. A nurse on another unit paused with a chart in hand, eyes widening at the sight of Marines flanking a bleeding general and a K-9 moving with silent purpose. The elevator doors opened. The team surged in. The gurney barely fit. Mercer stood at the head resident, squeezed beside him, Marisol and Darla at the sides. Hale and the other Marines holding the edges like they were guarding something sacred. Claire stayed close to Ranger, voice low. Sit. Ranger sat inside the crowded elevator without hesitation, eyes up, ears forward, body ready. For a moment, the elevator felt like a sealed capsule, carrying too many worlds. Hospital staff in scrubs, Marines still wearing dust and rain. A dog trained for combat. A general between life and death. The elevator rose. The numbers above the door blinked. No one spoke. When the doors opened on the surgical floor, the air changed. Colder, cleaner, quieter. The kind of quiet that came from rules and layers of controlled access. The OR team waited. Masks on, hands gloved, eyes focused. The trauma surgeon, Dr. Helena Rios, met Mercer at the threshold. She took one look at the patient, then the chest tube, then the blood cooler, being wheeled behind. You relieved attention, she said, not a question. Mercer nodded. We caught it in time. Rios's gaze flicked briefly to Claire and the dog. Her eyebrows lifted a fraction, but she did not indulge curiosity. She pointed. Bring him. The team rolled the gurney through the double doors. Ranger moved to follow. A nurse in the OR stepped in front of him, startled. No animals in the suite. Hale's body tightened instantly, ready to argue. Claire raised her hand slightly, palm down, a calming gesture, rather than a stop. Ranger, she said quietly. Stay. Ranger paused at the threshold, eyes locked on the general, disappearing through the doors. The dog's body trembled with restraint, but he did not push forward. He sat, head high, ears forward, as if guarding the doorway itself. Claire knelt beside him in the hallway, resting her hand against his neck. You did your job, she murmured. He is with surgeons now. Ranger's breathing was steady, but his gaze did not soften. He watched the doors, like he could see through them. Hale stood over Claire and the dog, face-tight, eyes fixed on the same doors. He doesn't leave him, he said, voice rough. Not until he knows. Claire looked up at him. Her expression was calm, but there was something in her eyes now that did not belong to a civilian nurse trying to blend in. He knows, she said. Price came out of the OR staging area, gloves stripped off, hands red at the wrists. He looked exhausted, the kind of exhaustion that lived deeper than sleep. His gaze landed on Claire. That phrase you used, he said. Raven 6. That is not general military. Claire's eyes returned to the OR doors. I know. Price's mouth tightened. Who taught you? Claire did not answer. Marisol appeared in the hallway, pulling off her gown, hair damp with sweat at the temples. She looked at Claire like she had been trying to assemble her since day one, and the pieces had finally shifted into a shape that made sense. You called the chest, Marisol said quietly. Claire nodded. Marisol took a step closer, voice softer. Where did you learn that? Claire's jaw flexed once. Not here. Marisol stared a moment, then looked away like she was giving Claire the dignity of not pushing. The OR doors stayed shut. Minutes passed in the sterile hallway measured by the absence of sound. Then an overhead page broke the quiet, calling for supplies, calling for blood, calling for the hospital to keep up with the damage being repaired behind closed doors. Hale paced twice, then stopped. Marines were not built to wait in hospitals. They were built to move toward problems, not stand outside them. Calvin Dorsey arrived on the surgical floor with a hospital administrator at his side, both moving with careful speed, faces set in a way that said this was no longer just medicine. Calvin's gaze flicked to Ranger, then to Claire's hand on his collar, then to Hale, then to the OR doors. The administrator, a woman with a crisp blouse and the kind of posture that communicated control, spoke first. "I am Janet Holloway," she said. "Hospital administration." Hale's eyes narrowed, not the time. Janet's expression did not change. "A dog and armed personnel entered our emergency department and interfered with care. It is exactly the time." Hale stepped toward her, careful but firm. "That dog is the reason he is still alive." Janet's gaze flicked to Ranger. "That dog nearly bit my doctor." Calvin cleared his throat. "Ma'am," he said to Janet, then to Hale, "we need to de-escalate." Price stepped in slightly, voice tired but sharp. "If you want to talk liability, talk to the enemy that put shrapnel in his body, not the nurse who kept him breathing." Janet's eyes flicked to Price, then back to Claire. The nurse, she repeated, as if the word itself carried an unfamiliar weight. Claire kept her hand on Ranger. She did not stand. She did not posture. She simply looked up at Janet with the calm of someone who had faced worse authority in worse places. Janet studied her badge. "Claire Bennett, Emergency Department." Claire nodded once. Janet's voice stayed controlled. "Ms. Bennett, security has reported that you used a verbal command that caused a military working dog to stand down." Claire did not react. Janet continued. "You also intervened verbally in medical decision-making outside your assigned role." Mercer's voice came from behind them, low controlled. She raised a concern. "I evaluated it. It was correct." Janet turned slightly. "Dr. Mercer, I appreciate the outcome. I also have policies to enforce." Mercer's jaw tightened. "Then enforce them after the patient is out of danger." Janet held his gaze. "That is not how institutions work." Claire listened, eyes steady, hands still. Ranger remained seated, eyes forward, a silent witness. The OR doors opened a crack, then wider. Dr. Rios stepped out, mask lowered, eyes tired but steady. "He is stable," she said. "We controlled the bleeding. He is going to ICU." A wave moved through the hallway, relief rippling across faces. Hale exhaled sharply, eyes closing for half a second, like a prayer he refused to name. Ranger's head lifted higher. His ears pricked toward Rios's voice. Claire leaned close to Ranger. "He is alive," she murmured. Ranger's tail gave a single small thump against the floor, restrained joy in a body trained to hold emotion behind duty. Rios looked at the dog, then at Claire. "He stays out here," she said, not unkindly. "ICU can decide policy." Hale stepped toward the OR doors. "I am going with him." Rios nodded. "You can follow the gurney. Not into ICU rooms. That is their call." Hale's gaze hardened. "It becomes my call if he cannot be protected." Rios's eyes did not flinch. "He is protected by nurses who do not carry rifles." Hale's mouth tightened. He did not argue further. The gurney rolled out, the general pale, but breathing more evenly now, tubes and lines trailing like the strings of a puppet holding him to life. Ranger rose and stepped forward instinctively. Janet moved to block him. "No!" Claire lifted her hand slightly, a quiet stop, and spoke to Ranger. "Wait." Ranger froze, then sat again, eyes locked on the gurney, rolling away, body trembling with restraint. Hale walked beside the gurney until the elevator doors swallowed it. When the elevator doors shut, the hallway felt suddenly empty. That emptiness did not last. Janet turned fully to Claire. Her voice stayed even, but it had shifted from crisis management to something more procedural, more dangerous in its calm. "Ms. Bennett," she said, "we need to speak privately." Mercer's eyes narrowed. "Now." Janet met his stare. "Yes, now." Marisol stepped closer to Claire, instinct protective. "She has been on shift. She has done nothing but help." Janet's gaze did not soften. She used language that appears to be military unit specific. "That is not a small issue. Price's expression tightened. She saved him. Janet's voice remained flat. Saving someone does not exempt you from scrutiny. Claire rose slowly, keeping her hand on Ranger's collar. The dog stood with her calm but alert. I will speak, Claire said. Haley was not there to object. The Marines had followed the general toward ICU. The hallway now belonged to hospital policies again. Janet gestured toward a small administrative office down the hall, a windowless room used for meetings that needed privacy and did not deserve comfort. Calvin walked beside them, posture careful, not hostile, vigilant. Marisol followed for a few steps until Janet turned her head slightly. Not you, Janet said. Marisol stopped eyes on Claire. Claire, she murmured. Claire met her gaze for a beat. There was no reassurance in her face. Only control. I am fine, Claire said, and the words were too measured to be fully true. Marisol stayed where she was, hands clenched at her sides, watching Claire disappear down the hall, like a person walking willingly into interrogation. The office smelled of paper and stale air. A rectangular table sat in the center with 4 chairs. A thin file folder rested near one end. A bottle of hand sanitizer sat beside it, like a token offering of cleanliness. Janet took the chair closest to the file. Calvin stood near the door. Another man entered behind them wearing a suit, face-neutral eyes, sharp. This is Mr. Latham, Janet said. Risk management. Latham nodded once, no smile. Ms. Bennett. Claire sat without being told. Ranger lay at her feet, head up, eyes tracking the room. The dog's presence filled the space in a way the furniture could not. Janet placed her hands neatly on the table. We will keep this direct. Claire nodded slightly. Janet's voice stayed calm. What did you say to the dog? Claire answered without hesitation. Raven 6 down. Latham's eyes narrowed. That is not a standard command used in civilian canine training. Claire said nothing. Janet opened the file. Your employment application lists your nursing degree, your licensure, your clinic experience. No mention of military service. Claire's gaze did not move. The application did not ask for it. Latham leaned forward slightly. We are not debating forms. We are discussing the use of unit-specific language that influenced an armed military escort in a civilian medical facility. Claire's voice stayed level. I influenced a dog. Calvin shifted near the door, uncomfortable. Janet's expression tightened. You understand the implications. Claire's eyes lifted to Janet's. I understand that a man was dying and nobody could touch him. Latham's mouth tightened. That does not answer the question of how you know that command. Silence stretched. Claire's fingers rested lightly on her knee still. Her posture stayed straight. She did not fidget. She did not look away. Janet watched her patient, but the patience carried pressure. Ms. Bennett. Janet said this hospital is responsible for safety, for compliance, for trust. When a staff member withholds relevant background and then demonstrates knowledge tied to military operations, it triggers concerns. Claire's jaw tightened once. I did not withhold my license. I did not withhold my training as a nurse. Latham tapped the file lightly. It is not only your nursing. Claire looked at him. Then say it plainly. Latham held her gaze. Were you military? Claire did not answer immediately. The pause was not hesitation. It was control. The same control she used to keep her voice from shaking when the world demanded it. Yes, she said quietly. I served. Janet's eyes stayed sharp. Branch. Claire's voice remained even. Navy. Calvin blinked once. Latham's eyebrows lifted slightly, then settled. Then why were Marines reacting to you? Claire's eyes lowered for a moment, then returned. Because I was attached. Janet's voice softened by a degree not sympathy, just clarity. What was your role? Claire's throat moved once as she swallowed. Hospital corpsman. The words hung in the sterile room like a different badge clipped to her chest. A title that carried sand and blood and long nights under dim light. Latham's voice stayed cool. Years. Claire answered in the tone of someone reciting a timeline for a report. 2018 to 2023. Janet's eyes flicked to the file again. Deployments. Claire's gaze stayed fixed. 2. Latham leaned back slightly. Locations. Claire held the stare. Helmand Province. Kandahar. Calvin's posture shifted a flicker of recognition in his face that he tried to hide. He had worn a uniform once. Places like that had weight. Janet's voice remained controlled. And you came here and did not disclose this. Claire nodded once. I did not. Latham's tone sharpened. Why? Claire's answer came steady. Because I wanted to be hired as a nurse. Janet watched her closely. You were hired as a nurse. Claire's eyes did not flinch. I wanted to be treated as one. Silence settled again, heavier now. Latham opened his mouth to speak, then closed it, recalculating. Janet tapped the folder lightly, a small sound in the sealed room. The dog, she said. Ranger. We have been told he has only stood down for his handler, his trainer, and his commanding officer. Claire did not respond. Janet leaned forward slightly. You are none of those. Claire's voice stayed calm. I do not need to be. Latham's eyes sharpened. Then what are you? Claire's gaze shifted briefly to Ranger, then back. Someone he recognizes. Janet's expression tightened. Explain. Claire inhaled slowly, then spoke with careful precision. Military working dogs respond to more than words. They respond to tone, cadence, familiarity. They respond to certainty. Latham's voice cut in. That is a technical explanation. It is not the operational one. Claire met his eyes. The operational one is that he was protecting his handler. He needed a signal that the threat had changed. Janet's fingers tightened together. You gave that signal. Claire nodded once. Yes. Latham's gaze held her. That implies connection to the unit associated with the code phrase you used. Claire did not answer. Janet's voice softened again, but only slightly. Ms. Bennett, you are sitting in a hospital office with risk management because you spoke a unit phrase in a civilian trauma bay and a military working dog obeyed you. We are not doing this for curiosity. Claire's eyes stayed steady. Then do it quickly. Latham's mouth tightened. Were you part of that unit? Claire's gaze dropped for half a second, then returned. I was assigned to them for a time. Janet's eyes narrowed. How long? Claire's voice stayed controlled. Long enough. Latham exhaled slowly. This raises issues. Claire's face did not change. It raises questions. Issues are what you call them when you want me to be the problem. Janet's eyes sharpened. Watch your tone. Claire nodded slightly. Yes, ma'am. The words were polite, but they carried a hard edge of experience, like someone who had said yes to authority that earned it and had learned how to say it when it did not. Latham looked at Janet, then back to Claire. We will need to verify your service. Claire nodded. You can. Janet's voice remained steady. We will also review whether your actions constituted working outside your scope. Mercer's voice came from outside the door, muffled but sharp. She did not perform a procedure. I did. Janet's eyes closed briefly as if she could feel the conflict building in the walls. She opened them again, calm returned like a mask. Claire's gaze flicked to the door, then back. I said what I saw. You can write policy about that if you want. Latham leaned forward again. Your intent does not erase risk. Claire met his stare. Risk is not always the enemy. Sometimes it is the only thing that keeps people alive. Calvin shifted again, uncomfortable eyes on Ranger. The dog's head remained up. His gaze moved between Claire and the door, listening. Janet took a breath. Ms. Bennett, I'm going to ask you one final question. Claire nodded. Janet's eyes held hers. Why did you come to Cape Haven? Claire's face stayed composed, but something in her eyes dimmed, like a light turned down. Because I needed quiet, she said. Janet's voice did not soften. This is not quiet. Claire's jaw tightened slightly. I know. Silence hung. Then Latham closed the folder with a soft slap and stood. We have what we need for now. Janet nodded once. We will be in contact. Return to the emergency department. Do not discuss this with staff. Claire rose without protest. Ranger rose with her calm and ready. Calvin opened the door. The hallway outside felt too bright after the office air. Mercy and noise returned in equal measure. The distant beep of monitors, the soft squeak of shoes, the faint smell of coffee from a station down the hall. Mercer stood nearby, arms crossed, eyes hard. Marisol stood beside him, her face tight with concern. Darla lingered behind, posture guarded. Mercer stepped toward Claire. "You saved him," he said quietly. "And you saw something I almost missed." Claire held his gaze. "You listened." Mercer's jaw flexed. "I also need to know who you are." Claire's expression stayed composed. "I am the nurse on your schedule." Mercer's eyes narrowed. "That is not what I meant." Claire did not answer. She turned slightly, guiding Ranger with a touch. Marisol stepped closer, voice low. "Are you okay?" Claire's eyes met hers for a beat. The calm held, but it was thinner now. "I am working," Claire said. Marisol's face tightened. "That is not the same thing." Claire nodded once, acknowledging without giving more. Then she walked down the corridor toward the elevator, Ranger at her side, nails clicking softly on tile. On the ICU floor, the door to room 7 was closed. Nurses moved in and out with quiet urgency. Monitors hummed behind glass. Hale stood outside the room, posture, rigid eyes fixed on the door like he could guard the general through it. Price leaned against the wall nearby, head back, eyes closed. The exhaustion finally claiming his face. Hale looked up as Claire approached. His gaze sharpened, not hostile now, but searching. "You admitted it," he said. Claire stopped a few feet away, keeping her space, keeping her calm. "Yes." Hale's voice stayed low. "You were a corpsman attached to Marines." Claire nodded. Price opened his eyes and looked at her. "Raven 6, he said again, softer now. "That is our call sign." Claire did not react. Her eyes moved to the ICU door. Hale followed her gaze. "He is alive," he said, as if offering it, like proof. Claire's shoulders eased a fraction. Good. Ranger sat beside her without being told, gaze fixed on the ICU door, ears forward. A nurse came out of the ICU room with a clipboard in hand and paused when she saw the Marines, the K9, and Claire. Her eyes flicked between them, uncertain. "Hale," she said quietly, "the patient is stable. He is sedated. Visiting is limited." Hale's voice stayed controlled. "We are not leaving." The nurse hesitated, then looked at Claire. "Are you the one who calmed the dog?" Claire's eyes stayed steady. "I kept him from biting your doctor." The nurse's mouth tightened, then softened. "Thank you," she said, then returned into the room. Hale watched Claire for a moment, his expression unreadable. "You could have let this be someone else's problem," he said. Claire looked at the ICU door. He did not have time for someone else. Hale's jaw tightened. "Neither did you." Claire did not answer. The hospital corridor settled into a quieter rhythm as the adrenaline bled away. The fluorescent hum returned to the foreground. The night shift continued, doing what it always did, absorbing trauma and moving on because it had to. Claire stood with Ranger at her side. Marines' nearby ICU doors closed in front of them. For the first time since she walked into Tidewater County Medical Center, the badge on her chest felt like it belonged to a person everyone could see clearly. Not because she wanted it that way, because tonight left no space for hiding. The ICU doors stayed closed for a long time, the kind of closed that made people stare, like their eyes could force them open. Claire stood near the wall with Ranger seated at her side, his posture tall and still, ears forward. Hale paced in short, tight lines that never took him far from the room. Price leaned back against the tile arms, folded eyes half shut, his face drawn in the exhausted calm that came after a near miss. When the door finally opened, an ICU nurse stepped out with a clipboard and a look that said she had already answered too many questions tonight. "He's stable," she said. "He's sedated. We're keeping him warm. His blood pressure is holding." Hale stopped pacing. His shoulders dropped a fraction, relief contained but real. "Can I see him?" Hale asked. "Not yet," the nurse replied. "Give us a few minutes. We need him quiet." Hale's jaw tightened, but he nodded. Ranger's gaze locked on the nurse's face as she spoke reading tone the way he read hands. Claire felt the dog's body shift under the invisible tension he carried. She kept her palm resting lightly on his collar, steady as a heartbeat. The nurse's eyes flicked to Claire. "Are you the one who calmed him?" Claire did not correct the word, him. She did not argue with the simplicity. "Yes." The nurse held her gaze for a beat, then nodded once and went back inside. Hale looked down at Ranger, then up at Claire, his expression hard to name. "He doesn't take commands from strangers," he said. Claire kept her eyes on the door. "He wasn't taking commands," she replied. "He was looking for certainty." Price pushed off the wall and walked closer, stopping at a respectful distance. His voice was quieter now, stripped of the edge that came with emergency. "That phrase," he said, "Raven 6. That isn't something you guess." Claire's eyes remained on the door. Hale's stare sharpened. "You served with us." Claire inhaled slowly. "I served," she said. "I did not come here to talk about it." Hale's hands curled into fists at his sides, then relaxed. "You can't speak our language and walk into our mission and pretend it isn't your business." Claire finally looked at him. Her face was calm, but the calm had a hard spine. "My business tonight was keeping him alive." Hale held her gaze, then looked away toward the ICU door, like he needed a different target for his anger. "He's retired," he muttered, as if the word itself was a betrayal. "He shouldn't have been anywhere near a blast." Price's eyes narrowed. They said base perimeter. Hale nodded once. "Convoy route. Somebody wanted a statement." Claire watched the door. She did not ask questions. The way Hale said it told her there were answers he would not give in a hallway. Minutes later, the ICU nurse returned. "One visitor," she said. 2 minutes. No noise, no arguing. If he looks like he's tiring, you leave." Hale stepped forward immediately. "Me." The nurse looked at his uniform, then at his face. 2 minutes. Hale nodded and went through the door. Ranger rose, then stopped at the threshold, eyes fixed on the opening. The dog's body leaned forward as if pulled by a rope tied to the bed inside. Claire spoke softly. "Stay." Ranger hesitated, then sat again, muscles trembling with restraint. The door shut. The hallway settled into a quieter rhythm. Machines hummed behind walls. Shoes squeaked in distant corridors. The hospital kept moving because it always did. Claire remained in place, one hand resting on Ranger's collar, her gaze still on the closed door. She felt eyes on her from passing staff curiosity and caution in equal measure. She did not react. She did not have the energy to manage other people's opinions. After 2 minutes, the door opened again and Hale stepped out. His face was tight, his eyes bloodshot at the edges, not from tears, from holding too much inside. "He's breathing on his own," Hale said quietly. He asked where Ranger was. He tried to sit up. Price let out a breath. "That sounds like him." Hale's gaze moved to Claire. "He asked about you too." Claire's stomach tightened. She kept her face still. Hale continued, voice low. "He heard your voice. He wants to see you." Claire's hand pressed a fraction more firmly against Ranger's collar. The dog's ears tilted toward Hale's words. The ICU nurse reappeared, expression guarded. "He's asking for the nurse," she said. Her eyes flicked to Claire's badge. "Bennett." Claire nodded once. "I will go." The nurse hesitated. 2 minutes. "He's tired." Claire stood. Ranger rose with her, then stopped when she stopped him with a glance and a quiet word. "Stay." Ranger sat, but his eyes followed her like a spotlight. Claire walked through the ICU door and into a room that felt colder than the hallway. Monitors glowed soft and steady. The air smelled like alcohol wipes and plastic tubing. General Richard Knox lay propped slightly skin pale against white sheets, face drawn but alert. His eyes were open sharp, even through pain medication, the kind of eyes that had learned to read truth in a half second. When Claire entered, his gaze locked onto her. Not confused, not searching, evaluating. Then his eyes shifted to the corner, where a nurse stood adjusting an infusion pump. "Give us a minute," Knox rasped. The nurse hesitated, then nodded and stepped out. Knox's voice was rough, scraped by a breathing tube that was no longer there. "You're the one." Claire stopped a few feet from the bed, posture, straight hands at her sides. "Yes, sir." Knox's mouth twitched a faint shadow of amusement. "Don't call me that. I retired last week." He coughed once, wincing, then steadied. "Almost retired permanently, apparently." Claire did not smile. She let the words sit. Knox watched her face like he was studying terrain. "Ranger listened to you." Claire answered carefully. Ranger listened to a command he recognized. Knox's eyes narrowed slightly. And you recognized him? Claire's jaw tightened, yes. Knox's gaze drifted to the line of bruising along his collarbone, then back to her. The doctor told me you caught a chest problem he didn't see. Claire nodded. He listened. Knox held her gaze. That is not common in a room full of ego. Claire did not respond. Knox inhaled shallowly and continued, voice softer, but no less direct. Hospital corpsman, attached to Marines. Claire's breath caught for a fraction of a second. She kept her face controlled. I served. Knox's eyes stayed steady. Where? Claire hesitated, just long enough to decide whether honesty would do damage. Helmand, she said. Kandahar. Something shifted in Knox's expression, a memory rising behind his eyes, like a tide. Helmand, he repeated. I was there in 2020. Forward base on the river line. Claire felt her throat tighten. She did not look away. Knox's voice dropped slightly. Field hospital. Long nights. Sand in everything. Screams that didn't stop when the sun came up. He swallowed, pain flickering across his face. I sent people there. Claire stayed silent. Knox watched her, then spoke again. Some of them came back because someone kept their lungs working while everything else fell apart. Claire's eyes lowered for a moment, then returned. We did our jobs. Knox's mouth tightened. You are doing it again. Turning the thing into a box so it doesn't cut you. Claire's voice stayed even. I am trying to be a nurse. Knox nodded slowly. You are a nurse. That is not the question. His eyes sharpened. Why are you here in a civilian ER in Cape Haven pretending you're just new staff? Claire's jaw flexed. I am not pretending. Knox held her gaze. You think hiding makes it stop following you? Claire did not answer. Knox's voice softened by a degree. I've watched people come home and try to be normal. Some pull it off. Most don't. Not because they want war, because war taught them things they can't unlearn. Claire's eyes shimmered slightly, then steadied. I came here for quiet. Knox's gaze stayed on her. And tonight found you anyway. Silence filled the room, not awkward, just heavy. Knox's eyes flicked toward the door, then back to Claire. The hospital administration is going to ask questions. They will talk about liability. They will talk about protocol. They will talk about what you did as if the only thing that matters is whether it fits their paperwork. Claire's posture remained straight. They already asked. Knox's expression tightened. And you told them. Claire nodded once. Knox exhaled slowly. Good. His eyes hardened. Because I will not let them turn competence into a problem. Claire's face stayed calm, but her stomach tightened again. You should rest. Knox's mouth twitched. I will. After I do what I need to do. The door opened and the ICU nurse stepped back in, gentle but firm. Time. Claire nodded once to Knox. Get better. Knox watched her closely. You too, he rasped. Claire turned and left the room, stepping back into the hallway where the air felt less intimate and more dangerous, because now it was full of systems. Ranger rose the moment she appeared, tail giving a single restrained thump. Claire knelt and rested a hand against his neck. He's alive, she murmured. Ranger's ears relaxed a fraction. Hale watched her, his gaze no longer suspicious, just intense. He asked about you, he said again, as if repeating it made it real. Claire stood. I'm going back to work. Hale's eyes narrowed. They might not let you. Claire did not respond. She walked down the corridor, Ranger beside her, and returned to the ER because that was what she did when the world got loud. By dawn, Tidewater County Medical Center looked normal again to anyone who had not been in Trauma 1. Sunlight pushed through the glass at the ambulance bay. The waiting room filled with new complaints that had nothing to do with blasts and generals. Nurses moved through the hall with coffee and clipped voices. The night shift wore exhaustion like a second uniform. Claire finished charting in the corner station, hands steady, face blank. Marisol sat across from her, eyes tired but sharp. You saw a tension, Marisol said quietly. You knew it before the ultrasound. Claire kept typing. I recognized the pattern. Marisol's gaze stayed on her. You recognized it because you have seen it. Claire's fingers paused for a half second, then resumed. I do not want to talk about it here. Marisol nodded slowly. Then tell me one thing. Are you safe? Claire looked up. Safe. Marisol's face tightened. That is not an answer. Claire held her gaze. I am not going to hurt anyone, if that is what you mean. Marisol's eyes softened slightly, then hardened again. I mean, are you okay? Claire returned her eyes to the screen. I am working. Marisol exhaled through her nose, a small sound of frustration. You say that like it is a shield. Darla walked past, overhearing, just enough to read the tension. Bennett, she said, voice clipped. Admin wants you upstairs at 9. Claire's chest tightened. Why? Darla's mouth set. They didn't say. They said it is urgent. Marisol's eyes narrowed. You already talked to them. Darla nodded. Apparently they want more. Claire nodded once, face calm. Okay. The shift ended. People clocked out. The ER moved on to day shift, handing off patients and problems like batons. Claire changed out of scrubs, washed her hands, and walked upstairs to administration. Janet Holloway's office smelled like paper and air freshener. Policy binders lined a shelf like armor. A framed mission statement hung on the wall, polished enough to look expensive. Janet sat behind her desk with a folder open. Mr. Latham was there again, face neutral. Calvin stood near the door, posture professional. Claire stepped inside and stopped in front of the desk. She did not sit until Janet gestured to the chair. Janet's voice was measured. Ms. Bennett, we have reviewed preliminary reports. Claire nodded, yes. Latham spoke next, voice flat. You provided medical direction in a trauma bay. Claire's eyes shifted to him. I provided an observation. Dr. Mercer made the decision. Janet lifted a hand, slightly controlling the pace. Dr. Mercer has confirmed that. We are not accusing you of performing procedures. Claire's shoulders eased a fraction, then tightened again. Accusations were not the only way institutions hurt people, Janet continued. We are addressing two concerns. Your undisclosed military background and the use of unit-specific language in the emergency department. Claire kept her face still. My background does not change my license. Latham's eyes sharpened. It changes risk. Claire's jaw flexed. A patient died when nobody could touch him. That was also risk. Janet held her gaze. We are not debating outcomes. We are determining whether your presence creates a liability exposure. Claire stared at her. You are calling me a liability. Janet's expression tightened, but she did not deny it. This hospital must protect itself. Claire's voice stayed controlled. From what? Competence. Latham leaned forward slightly. From unpredictability. From staff acting outside defined roles. Claire's eyes held his. If you define roles so tightly that people cannot speak when they see danger, you are not safe. You are quiet. Janet's face hardened. Careful. Claire nodded once. Yes, ma'am. Janet opened the folder and slid a paper across the desk. Effective immediately, you are placed on administrative leave pending review. The words were clean. The ink was dark. The paper looked harmless in the way paperwork always did, even when it was a blade. Claire did not reach for it. She watched it like it might bite. Marisol's voice flashed in her head. Are you okay? Claire kept her face controlled. How long, she asked. Janet's voice remained even. We do not have a timeline. Claire nodded once. Am I fired? Janet hesitated, then answered with administrative precision. Not at this time. Claire inhaled slowly. Her calm stayed in place, but something behind it tightened hard. And Ranger Claire said because that mattered more than the paperwork. He is with the Marines. Janet nodded. The military will manage the dog. That is not our concern. Claire looked at the paper again. Administrative leave. A pause disguised as mercy. She stood. Am I allowed to speak to Dr. Mercer? Janet's gaze stayed sharp. You may not discuss internal matters publicly. You may not post about this. You may not contact media. You may not interfere with the review. Claire's eyes narrowed slightly. I do not use social media. Janet nodded once as if filing that away. Good. Claire turned to leave. Calvin opened the door. His face was careful. Ma'am, he said quietly as she passed a tone that suggested he did not like this. Claire did not respond. She walked out of the office and down the hall toward the elevator, the building suddenly feeling less like a workplace and more like a machine that had decided she was an error. She drove home on roads bright with morning sun. The world outside looked indifferent. Beach signs, gas stations, a man walking a dog along the sidewalk. Nobody knew that a general had nearly died in her hands, or that the price of saving him was now a sheet of paper on an administrator's desk. At her apartment, she sat at the kitchen table and stared at the blank wall. The silence she had wanted did not feel quiet. It felt like containment. Her phone buzzed. Marisol's name. Claire answered. They put me on leave. Marisol's voice hit hard through the speaker. They did what? Claire's face stayed blank. Administrative leave pending review. Marisol exhaled sharply. You saved a man's life. Claire's eyes closed for a brief second. That does not matter to policy. Marisol's voice tightened. It matters to us. Claire kept her voice controlled. Do not make this bigger. Marisol's reply came fast. It is already bigger. They did it to cover themselves. They will say it is neutral. It is not. Claire's stomach tightened. I just wanted to work. Marisol's voice softened, then hardened again. You picked the worst place to be invisible. Claire did not respond. Marisol continued. Mercer is furious. Darla is furious. People are talking. Claire opened her eyes and stared at the wall again. Tell them to stop. Marisol let out a short, bitter laugh. You think anyone can stop it after last night? Claire's jaw flexed. I do not want attention. Marisol's voice dropped. You do not get to choose attention when you are the reason a man is alive. Claire's fingers tightened against the edge of the table. I do not want to be a symbol. Marisol paused, then spoke quieter. Then be a person. Come back. Let us stand with you. Claire's voice stayed even, but the words came out tired. I do not know if I can. Marisol's reply was immediate. You already did. The line went quiet for a moment, the kind of quiet that carried weight. Marisol spoke again. Do not disappear. Not today. Claire swallowed. Okay. She hung up and sat still, breathing slow, staring at the wall as if she could keep her thoughts pinned there. At the hospital, the news moved faster than Janet Holloway expected. It started at the nurses' station in the small breaks between tasks when people traded information like currency. Darla told one nurse who told another. A resident overheard. A tech saw Mercer's expression and asked why. By mid-morning, it had reached the break room. Dr. Mercer walked in still in Scrub's hair slightly damp, as if he had washed his face and failed to wash off anger. Marisol was there, coffee untouched, eyes sharp. Darla leaned against the counter with her arms crossed, jaw set. Mercer spoke first. They put her on leave. A nurse across the room blinked. For what? Mercer's voice went cold. For doing the right thing. Darla's mouth tightened. For being a risk. Marisol slammed her coffee cup down hard enough to splash. She was not a risk. She was the only reason we could even touch the patient. A resident younger face, still pale from the night, spoke quietly. She saw the chest problem before anyone else did. Mercer nodded once, eyes hard. She did. A tech named Jonah spoke up from the corner. She caught a medication error on her third day. Saved a kid from getting the wrong dose. Another nurse added, voice firm. She took my overnight shift last week when my mother was in the hospital. More voices rose, not loud, just stacking each one, adding weight. Small moments that had not seemed like a story until now. Darla pushed off the counter. They think she will quietly resign. Mercer's eyes narrowed. She is not going to be pushed out. Marisol looked around the room. Then we make noise. A resident pulled out his phone. Slack. Darla's voice snapped. No names in writing. Not yet. Mercer moved to the table and grabbed a blank sheet of paper, then a pen. His hand moved fast, controlled writing, with the same decisiveness he used in trauma. I am writing to the board, he said. Formal, direct. No emotion. Just facts. Marisol stepped closer. I will sign. Darla did not hesitate. Me too. The paper moved around the room. Hands signed. Nurses, techs, residents. People who argued over protocols and charting and schedule swaps now aligned without hesitation. Within an hour, the letter had 47 signatures. By lunch, it was in the hands of a board assistant. By early afternoon, someone posted something online anyway. Not a name, not a full story. One sentence that hit like a match in dry grass. A nurse punishes the person who saved a veteran's life. It spread faster than anyone expected. Veteran community pages picked it up. Comments multiplied. Phone calls began. Tidewater County Medical Center's main line started ringing so often the receptionist stopped saying hello. Call after call, voices sharp, demanding to know if the hospital punished veterans. Demanding to know if the hospital was safe. Demanding answers Janet Holloway had not prepared. Janet sat in her office and listened to her assistant read off the growing pile of messages. Her face stayed composed, but her eyes tightened. Local news is calling, the assistant said. Janet's jaw flexed. We do not comment on personnel matters. The assistant hesitated. They are saying it is not just personnel anymore. Janet leaned back in her chair and stared at the policy binders. They looked less like armor now and more like weight. Her desk phone rang. She answered. Janet Holloway. The voice on the other end was smooth and cold. Legal counsel. Your situation is escalating. Janet's fingers tightened on the handset. We have a process. Legal counsel replied. The public does not care about process. Janet's gaze drifted to Claire's thin file folder. She acted outside her scope. Counsel's tone stayed unmoved. You will need to demonstrate that. Carefully. Janet's voice tightened. She saved him. Counsel paused a fraction, then responded. This time. Janet closed her eyes briefly. The same phrase again, like a weapon. When she opened them, her assistant was still standing there, face tight. They are calling her a hero, the assistant said quietly. Mercer wants to commend her. Janet's eyes hardened. Mercer does not sign the insurance. The assistant's voice dropped. Do you? Janet did not answer because the truth was that her job was not to love heroes. Her job was to keep the institution standing even when heroes complicated the math. By late afternoon, the board called an emergency session. The boardroom sat on the top floor, all glass and polished wood, designed to look confident. It smelled faintly of expensive coffee and disinfectant. Board members filed in, faces stern, phones buzzing with notifications they pretended not to read. Janet stood at the head of the table with a folder in her hands, posture straight, expression controlled. We have a developing public relations issue, she began. One board member, older silver hair, frowned. Start with facts. Janet nodded. A patient arrived last night under military escort. A working dog prevented staff from providing care. A nurse used an unknown command phrase to control the animal and then influenced medical decision-making. A board member's eyebrows rose, influenced. Janet held the gaze, suggested a diagnosis. It was correct. The patient survived. That does not remove the risk. Another board member leaned forward. Who is the patient? Janet hesitated, then answered. Major General Richard Knox. The room shifted. The name carried weight even in civilian space. A board member exhaled. That is not minor. Janet nodded. No. A man at the far end spoke, voice calm. What do the Marines want? Janet's mouth tightened. They have not made demands. Yet. A board member tapped the table. And the nurse. Janet opened her folder. Claire Bennett. Employed 7 days. File does not indicate prior military service. The board members exchanged glances. Another member spoke, voice sharper. Why would she hide it? Janet's expression tightened. That is one of the questions. The door handle turned. The boardroom fell silent as the door opened and a man stepped inside, who did not look like he belonged to a hospital meeting. Major General Richard Knox wore dress uniform. Ribbons lined his chest in tight rows. His movements were slower than they should have been, a cane in his hand, but his posture was still command. At his side walked Ranger Nails, clicking softly on the floor, eyes alert. The room shifted again, chairs scraping as a few board members rose on instinct, then hesitated, unsure whether to treat this as protocol or intrusion. Knox looked around the table. Eyes, sharp voice, rough, but steady. I hope you do not mind. I am the patient you are discussing. Janet's face stayed composed, but a faint pulse of anger flickered in her eyes. General Knox, with respect, this is a personnel matter. Knox's mouth tightened. I am personnel, he said evenly. And so is Ranger. He took a seat without waiting for invitation, cane resting against the table edge. Ranger sat beside him with calm precision. Knox looked at each board member in turn. I led men and women for 30 years, he said. I know courage. I know competence. I also know when a system is about to punish the person who made it work. Janet's hands tightened on her folder. General, we are not questioning her competence. Knox nodded slowly. Then stop acting like competence is the problem. A board member cleared his throat. We are questioning protocol. Knox's eyes held him. Protocol would have killed me. The words landed heavy in the room. Nobody spoke for a beat. Janet's voice remained controlled. Protocol exists to protect patients. Knox's gaze shifted to her. Then explain how I was protected when nobody could touch me. Janet's jaw flexed. The dog created an unsafe environment. Knox nodded once. The dog was doing his job. He was protecting me when I could not protect myself. A board member leaned forward. The nurse used a unit-specific code. That raises concerns. Knox's eyes sharpened. Concerns for whom? For liability, Janet said. Knox's expression hardened. Liability is what you call fear when you dress it up. Janet's voice tightened. Fear keeps hospitals open. Knox met her stare. Fear also kills people when it makes you hesitate. The room held its breath, trapped between administrative language and battlefield clarity. Knox continued, voice calm but forceful. Claire Bennett saw something your team almost missed. She gave a warning. Your doctor verified it. He acted. I lived. A board member frowned. She hid her background. Knox turned to him. Why should she have to announce it to earn a job? The board member's mouth opened, then closed. Knox's voice stayed steady. If you punish her, you send a message to every veteran in this county. That their skills are welcome only when they are quiet, only when they are convenient. Janet's eyes narrowed. General, we support veterans. Knox held her gaze. Then prove it. Ranger's ears flicked at the tone in the room, but he remained still, a calm presence beside his handler. Knox leaned forward slightly, voice lower, more personal. I will sign whatever waivers you think you need regarding my care, he said. I will take that excuse off your table. Janet's mouth tightened. That does not remove all exposure. Knox nodded once. Then stop pretending this is only about exposure. He looked around the table again. You are deciding whether a hospital in a military community can recognize competence when it wears a uniform or whether it will punish it because it makes paperwork uncomfortable. The room stayed silent, the air thick with the kind of tension that did not come from violence but from power shifting hands. The silence in the boardroom did not break with shouting. It broke with breathing, with small shifts of posture, with people recalculating what power looked like when it walked in wearing ribbons and a cane. Janet Holloway kept her hands flat on the folder in front of her. Her face stayed composed, but her eyes had narrowed into something sharper than caution. General Knox, she said, voice even, I respect your service. I respect what happened last night. But we cannot allow emotion to rewrite clinical boundaries. If staff believe they can bypass protocol because they feel certain patients die, Knox did not blink. Patients die when you treat uncertainty like disobedience. A board member cleared his throat, trying to find neutral ground. Janet is not wrong about scope. Hospitals have to draw lines. Knox turned his head slowly toward him. Then draw the line where it belongs. Between a nurse performing a procedure and a nurse seeing a threat before your monitor catches up. Janet's jaw tightened. We also have an employment integrity issue. She did not disclose prior military service. Knox's eyes cut back to her. Did she lie? Janet hesitated. No. Did she falsify credentials? No. Did she harm a patient? No. Knox leaned forward slightly, the cane resting against the table. Then what you have is a staff member who wanted to be judged by her work, not by a label. That is not a violation. That is a survival strategy. Janet's expression hardened. This is a hospital, not a battlefield. Knox's voice lowered, rough and precise. Last night, it was both. Ranger sat at Knox's side, still as stone. His gaze moved across faces, then returned to Knox, then to the closed door, as if he tracked every shift in the room's temperature. The veteran board member who had spoken earlier, the man with the quiet Vietnam admission, leaned forward and placed his fingers on the table. "Janet," he said softly, "the general is right about one thing. If we treat this as a threat, we will lose the trust of the exact community we serve." Janet's eyes flicked to him. "Our duty is to this hospital. And this hospital sits in a military county," the veteran member replied. "Trust is not optional." Another board member, younger, looked unsettled. "If we reverse course, we reward deviation." The veteran member held his gaze. "We reward an accurate warning that saved a life." Janet lifted her folder slightly, as if it were a shield. "Accuracy is not the only metric. Precedent matters." Knox's voice cut in, controlled. "Then set a precedent worth keeping." Janet's nostrils flared once. She turned her head to the board chair, a woman with sharp eyes and a calm manner that suggested she had spent a lifetime listening to storms without stepping into them. "Madam Chair," Janet said, "this is not a decision we should make under pressure." The chair's gaze moved to Knox, then to Ranger, then back to Janet. "We are under pressure," she said. "The question is whether we use it to clarify or to hide." Janet's mouth tightened. "We can place her on leave until verification is complete. That is standard." The chair tapped her pen once against the table. "She is already on leave." Janet hesitated. The chair continued, calm and firm. "General Knox is here. The ER physician has documented the clinical sequence. We can verify service in hours if we choose. The conflict is not ignorance. It is appetite for risk." Janet looked down at her folder, then back up. "I am responsible for risk." Knox's voice softened slightly, not kinder, just more personal. "And I am responsible for the people who get hurt when institutions punish the wrong thing." The chair exhaled slowly. "We will speak to Ms. Bennett directly." Janet's eyes tightened. "Now." "Yes," the chair replied. "Now." Janet turned toward the board assistant seated near the door. "Call her." The assistant stood and stepped out. For the first time since he entered, Knox shifted his hand toward Ranger's neck and rested 2 fingers there, a small contact. Ranger's ears flicked, then relaxed. "You are pushing hard," one board member said, voice cautious to Knox. "You understand this is not a military command climate." Knox's eyes stayed steady. "Then stop treating competence like insubordination." A few minutes later, the door opened again. Claire Bennett stepped in. She did not wear scrubs. She wore simple clothes that made her look like any other young woman called into a meeting she did not want. Her hair was pulled back the same way it always was, tight and controlled. She entered without hesitation, then stopped at the edge of the table, hands loosely clasped, posture straight. Her eyes moved once across the room. Board members, Janet, Knox, and Ranger. Ranger's body shifted. His tail thumped once against the carpet, restrained. His head lifted higher, eyes bright as if a private signal had passed between them without words. Knox watched Claire the way he watched a map. "Ms. Bennett," he said, voice rough. "Thank you for coming." Claire's gaze met his. "General." Knox's mouth twitched faintly. "Retired." Claire nodded once, acknowledging. Janet spoke before anyone else could settle into the moment. "Ms. Bennett, we are conducting a review. You have been placed on administrative leave pending verification and assessment." Claire's face remained still, yes. Janet slid the folder slightly toward herself as if keeping it close mattered. "We have concerns regarding your non-disclosure of military background and your actions in the trauma bay." Claire's eyes did not flinch. "I did not perform a procedure." Janet's expression tightened. "You influenced medical decision-making." Claire turned her head slightly toward Dr. Mercer, who stood near the wall at the back of the room, arms crossed, jaw hard. Mercer gave a small nod, as if reminding her she was not alone in what had happened. Claire looked back to Janet. "I gave an observation." Dr. Mercer evaluated it. The chair lifted a hand, controlling the pace. "Ms. Bennett, We have read the clinical notes. We are not here to debate whether your observation was correct. Claire nodded once. The chair continued. We are here to decide what happens next. Janet's lips pressed together. She had wanted this to be paperwork. It had become theater. Knox spoke calm and steady. Claire, tell them why you came to Cape Haven. Claire's eyes returned to him. She held the gaze for a beat, then answered in a voice controlled enough to keep emotion from spilling. I came here to work, she said. I came here to be a nurse. A board member leaned forward. You were a corpsman attached to Marines. Claire nodded. Yes. Another board member's voice tightened. Why omit that? Claire did not raise her voice. Because when you lead with it, you do not get hired as a nurse. You get hired as a story. Janet's eyes narrowed. That is an assumption. Claire met her gaze. Is it? The room went quiet. Janet's jaw flexed, then she looked away first. The chair spoke again, calm. Ms. Bennett, we would like to offer you a position. Claire did not react immediately. Her face remained still, but her fingers tightened slightly where her hands were clasped. Janet's eyes flashed. Madam Chair. The chair did not look at Janet. This board has authority to create roles in response to community needs. Janet's mouth tightened. She looked at the veteran board member, who gave a subtle nod as if saying this was the line they had reached. The chair continued. We are establishing a Veterans Care Liaison and Trauma Readiness Initiative within Tidewater County Medical Center. Claire's gaze stayed steady. The chair glanced down at a single page in front of her, then back up. We want you to lead it. Claire did not speak. Janet forced herself to continue, voice carefully measured. The role would include training ER and ICU staff on military-specific trauma patterns, coordinating care for veterans who may have unique needs, and serving as a bridge between this hospital and local veteran organizations. Claire's chest tightened. She kept her face controlled. Knox watched her without blinking. Ranger's ears stayed forward, attentive. Claire spoke slowly. You want to make me visible. Janet's expression tightened. We want to make the hospital safer. Claire held her gaze. Those are not the same thing. The chair leaned forward slightly, her tone calm but direct. Ms. Bennett, we cannot pretend what happened last night did not happen. You were not visible because you sought attention. You were visible because your skills surfaced in crisis. Claire's eyes flicked down for a moment, then returned. I did not come here to be an initiative. Janet's voice sharpened. You came here with a background that changes our environment. Claire looked at Janet. You mean your comfort? Janet's cheeks tightened. Watch your tone. Claire nodded once. Yes, ma'am. Knox's voice cut in gently but firmly. Let her speak. Claire inhaled slowly. She looked around the board table, seeing the polished wood, the suits, the binders, the careful faces. She had sat across from authority before. She had learned the difference between authority that protected and authority that protected itself. I will ask one question, Claire said. The chair nodded. Go ahead. Claire's eyes returned to Janet. If I told you in my interview that I was a corpsman attached to Marines deployed with combat medical experience, would you have hired me? The room held still. Janet hesitated, then answered with painful honesty. I do not know. Claire nodded slowly. That is why I did not lead with it. Janet's mouth tightened. You forced us into this. Claire's gaze sharpened. No. Last night forced you into this. Mercer shifted at the wall, his voice low but clear. She gave an accurate warning. I validated it. I acted. That is the sequence. The chair nodded. We understand. Claire looked back to the chair. If I accept this role, I will not be used. Janet's eyes narrowed. Used how? Claire's voice stayed controlled. For press. For banners. For speeches that make you feel better while the culture stays the same. The chair's gaze remained steady. What would you require? Claire's fingers loosened slightly, then clasped again. A written policy, she said. Protecting staff who speak up when something does not fit. A requirement that military trauma training be integrated into ER readiness. Not optional. Integrated. Janet's lips pressed together. Claire continued, voice calm. A formal partnership with veteran support organizations in the county, so veterans do not have to explain themselves from scratch every time they walk in here. and clear boundaries about scope written in a way that does not punish observation. Janet's eyes tightened. You are negotiating with a hospital board. Claire met her stare. I am stating what it takes to make this real. The chair leaned back slightly, considering. The veteran board member nodded slowly, as if this matched the language of someone who had seen institutions fail people quietly. Janet's voice came tight. And what about your non-disclosure? Claire's eyes stayed steady. My license is on record. My training is real. Verify my service. Put it in my file. But do not turn it into a scarlet letter. Janet stared at her, then looked toward the chair. This sets precedent. The chair nodded once. Yes, it does. Knox spoke, voice rough but calm. Set the right one. Janet's eyes flicked to him, anger and calculation in equal measure. General, with respect, you do not run this hospital. Knox's gaze held hers. No. But you will run it in a military county. Choose whether you run it with courage or fear. The chair placed her pen down gently. Ms. Bennett, if we agree to your conditions, will you accept the role? Claire's throat moved once as she swallowed. The room waited. She looked down briefly, not in submission, in thought. Then she lifted her gaze. I will accept, she said, voice steady. With those conditions in writing. Janet's jaw tightened. The chair nodded. We will draft them immediately. Knox's shoulders eased just slightly. Ranger's tail thumped once more, a quiet punctuation. Janet exhaled slowly, then turned to Claire, voice still controlled, but quieter now. You will also agree to disclose your military service to HR fully. Claire nodded, yes. Janet's eyes narrowed. And you will follow chain of command here. Claire's gaze stayed steady. I followed it last night. I spoke. The doctor acted. Janet's mouth tightened, but she did not argue. The chair stood. This meeting is adjourned. Chairs shifted. Papers gathered. Board members rose in small clusters, murmuring. Knox stood slowly, cane steady, Ranger rising at his side with smooth discipline. Claire remained still for a beat, as if waiting for the room to stop vibrating with adrenaline. Knox stepped close enough to speak quietly. You did not want to be seen, he said. Claire met his gaze. No. Knox nodded once. You were anyway. Claire did not answer. Knox's voice softened slightly. You did good work. Claire's jaw tightened. Praise did not land easily. I did what needed to be done, she said. Knox's mouth twitched again, faint. That is why I trust you. He turned and walked out with Ranger at his side. The dog's head turned once toward Claire as they passed the door, then forward again, mission steady. Janet lingered behind, gathering her folder with precise movements. When she looked up, she held Claire's gaze for a moment longer than necessary. You understand, Janet said, voice low. This hospital will watch you closely. Claire nodded. I expect it. Janet's eyes narrowed. Good. Then Janet left. When the boardroom emptied, Mercer stepped away from the wall and approached Claire. His expression was tired, the kind of tired that lived behind the eyes. They did not break you, he said quietly. Claire's gaze stayed steady. They tried to file me. Mercer's mouth tightened a brief grim smile. That too. Marisol appeared at the doorway, eyes searching Claire's face for damage. Well, Marisol said softly. Claire exhaled slowly. I am not fired. Marisol's shoulders dropped with relief that she did not try to hide. Good. Claire looked at her. They offered me a program. Marisol's eyebrows lifted. You. Claire nodded once. Marisol studied her for a moment, then spoke carefully. Do you want it? Claire's face stayed composed. I want to work. Marisol nodded, then work. Claire's eyes shifted toward the elevator. I need to go home. Mercer's expression softened slightly. Go. Claire walked out of administration down the long corridor and into the elevator alone. When the doors closed, her shoulders sank a fraction, just enough to show the weight she had been holding up with posture. At home, she opened her closet and took down the shoebox she had never unpacked. She placed it on the table. She stared at it for a long time. Then she opened it. Inside were small things that held more than their size. A worn coin, a patch, a folded piece of cloth that had once been part of a uniform, a chain. Claire touched the edge of the patch with 2 fingers, then let her hand rest there. as if grounding herself to something she had tried to bury. She did not cry. She did not smile. She simply sat with the truth until it stopped feeling like it might explode. The next day, she returned to Tidewater County Medical Center for a meeting with HR. The HR manager, Tessa, looked nervous, as if she feared Claire might accuse her of betrayal. Claire handed over documentation calmly. Service record, discharge status, certifications, courses, training. Tessa flipped through the papers with wide eyes. "This is a lot," she murmured. Claire's voice stayed neutral. "It was my job," Tessa swallowed. "Why did you not include it?" Claire held her gaze. "Because I wanted to be hired as a nurse." Tessa nodded slowly, as if the phrase was beginning to mean something different to her now. By the end of the week, the hospital created the new role on paper: a title, a short description, a list of responsibilities. Claire read it in silence, then looked up at Janet Holloway across the desk. "I will do this," Claire said, "but we do not turn it into a parade." Janet's expression stayed controlled. "We need to reassure the public." Claire met her gaze. "Reassure them with competence, not slogans." Janet's jaw tightened. "We will be issuing a statement." Claire nodded. "Keep my name out of it." Janet hesitated. "That may not be possible." Claire's eyes narrowed. "Then make it as small as you can." Janet exhaled slowly. "Fine." 2 weeks later, General Knox was discharged. He walked out of the hospital under his own power cane, in Hand Ranger at his side, Marines flanking them like a quiet honor guard. The lobby turned and watched. Staff lined the hallway without being asked. Knox paused near the front desk and looked toward the nurses' station, where Claire stood, not seeking attention, just present. He held her gaze for a moment, then nodded once. Claire nodded back. Ranger's tail thumped twice against his vest, restrained joy. Claire did not approach. Ranger did not break formation. The exchange was enough. 3 months later, Tidewater County Medical Center did not look dramatically different from the outside. Same glass, same parking lot, same hum of vents. But inside, small things had shifted. On a Tuesday afternoon, Claire stood in a training room facing a group of nurses and residents. A whiteboard sat behind her. A projector glowed. The room smelled like dry erase markers and coffee. Marisol sat in the back, arms folded, watching with the quiet pride of someone who had seen Claire step out of a shadow. Claire's voice was calm, precise, not theatrical, not heavy. "Combat trauma does not always announce itself where you expect," she said. "Blast injuries can hide behind obvious wounds. The body compensates until it cannot." A resident raised a hand. "How do you spot it early?" Claire looked at him. "You watch the pattern. You listen to what does not match the story." She clicked to an image on the screen, a diagram of the chest. She pointed simple. If oxygen drops in steps and the chest rise is uneven, you check the lungs even if the wound is elsewhere. You do not wait for the monitor to tell you what your eyes can see. Another nurse spoke. "We do not get many blast injuries." Claire nodded. "You get veterans. You get people who trained around explosives. You get people who carry patterns in their bodies. You do not need a war zone to meet war." The room stayed quiet, attentive. A nurse in the front row asked, voice hesitant, "What about the way veterans react? The anger, the silence." Claire's gaze softened slightly, not sentimental, just honest. "You do not take it personally," she said. "You give them control where you can. You explain what you are doing before you touch them. You tell them what the next sound will be. You keep your voice steady." A tech raised a hand. "What about working dogs? If a military K9 comes in again?" Claire's eyes flicked briefly, then returned. "You do not approach fast. You do not stare. You keep your hands visible. You ask for the handler. And you respect that dog is not scared. It is working." No one laughed. No one rolled eyes. They were listening. After training, Claire walked the ER floor in scrubs again. The badge on her chest now had an additional line under her name. Veterans Liaison. She did not love the label. She accepted it. In Trauma 1, a paramedic rolled in a patient with a head wound from a fall. The case was ordinary. The pace was familiar. Claire moved with the same quiet competence as always. She started an IV. She charted vitals. She spoke gently to the patient. The work grounded her in a way meetings never did. Later that night, a veteran arrived in the waiting room. An older man with shoulders still squared like the posture had hardened into bone. His hands shook slightly as he tried to hold a clipboard. His eyes moved fast, scanning exits, scanning corners. The triage nurse's voice was kind but brisk. "Sir, I need you to answer these questions." The man's breathing tightened. His fingers clenched around the pen until his knuckles went pale. "I do not like this," he muttered. The triage nurse hesitated, uncertain how to bridge the gap without escalating. Claire stepped closer, not rushing, and spoke softly. "Sir." The man's head snapped toward her eyes, sharp, suspicious. Claire kept her hands visible. She lowered her voice steady. "You are safe here. Tell me what is making it hard." The man swallowed. "Too many people," he said. "Too many sounds." Claire nodded. "We can move you to a quieter room. We will explain everything before we do it. You do not have to guess." The man's shoulders eased a fraction, as if someone had loosened a knot. He glanced down at her badge, then looked back up. "You served," he said quietly, not a question. Claire hesitated, then nodded once. "Yes." The man exhaled relief flickering across his face, so fast it might have been missed by anyone not trained to watch. "Good," he whispered. "Then I do not have to translate myself." Claire gave a small nod. "You do not." In the weeks that followed, Claire built the program without fanfare. She met with local veteran organizations. She learned which support groups met on Wednesdays and which met on Sundays. She learned who needed transportation help and who needed privacy. She helped staff understand why some veterans did not like being touched from behind, why some did not like closed doors, why some reacted to the slam of a trash can lid like it was a threat. She did not fix everything. She made the hospital less blind. One afternoon, Janet Holloway stood at the back of a training session, arms crossed, listening. Her face remained composed, but her eyes had a different look, now less defensive, more thoughtful. After the session, Janet approached Claire in the hallway. "You are making an impact," Janet said, as if admitting it cost her something. Claire nodded once. "That is the point." Janet hesitated. "I still have to worry about liability." Claire met her gaze. "Then worry about the liability of ignoring the truth." Janet's mouth tightened, but she did not argue. Outside the hospital, General Knox attended a fundraiser at the Cape Haven Civic Center. A modest stage, folding chairs, flags behind the podium. The room full of veterans' families, hospital staff, local officials. Knox stood at the podium, voice strong again, cane resting beside him. Ranger sat at his feet, vest lighter, now a patch, reading Therapy Dog, stitched across the side. Claire sat in the back row, not trying to hide, not trying to be seen. Marisol sat beside her, arms folded, eyes on the stage. Knox spoke without theatrics. "People say thank you for your service," he said. "Sometimes they mean it. Sometimes they mean they want the conversation to end." A murmur moved through the crowd, soft agreement. Knox continued. "If you live in a military community, you will meet veterans in grocery stores, on fishing docks, in hospitals. Their service does not disappear because the uniform does. Their skills do not either." His gaze swept the room, then landed briefly on Claire. Knox did not say her name. He did not need to. He spoke of building bridges between military and civilian medicine. He spoke of training and readiness. He spoke of care that did not require veterans to fight for dignity. Ranger remained still, calm, eyes attentive. After the fundraiser, people gathered in small clusters. Veterans shook hands. Nurses spoke quietly, trading stories of shifts. Someone asked to pet Ranger, and Ranger leaned into the touch with gentle patience that would have seemed impossible the night he guarded a bleeding general. Claire watched from a few steps away. Ranger lifted his head and looked at her, ears forward. Claire walked over and knelt. She rested her hand against his neck. "You are doing good work," she murmured. Ranger's tail thumped once, then settled. His eyes stayed on hers for a moment, then moved back to the room, scanning out of habit, not fear. Marisol approached, holding 2 cups of coffee. She handed one to Claire. "You look different," Marisol said quietly. Claire took the cup. "Different how?" Marisol studied her face. "Like you are not trying to disappear every second." Claire's fingers tightened around the cup, then loosened. I am trying to function. Marisol nodded. That counts. They stood together for a moment, watching the room. Across the hall, Knox spoke to a veteran in a wheelchair, leaning down to listen. Ranger sat beside them, calm present, not performing. Claire looked at the scene, the pieces aligning in a way she had not planned. She did not smile. She did not cry. She simply stood there, coffee warming her hands, and let herself exist in a room that did not demand she be smaller. Back at Tidewater County Medical Center, the ER doors opened and closed every day with the same tired rhythm. Gurneys rolled, phones rang, monitors beeped. Pain arrived and left and arrived again. Claire worked shifts and trained staff. She handled ordinary cases and the rare ones that carried echoes of combat. She did not tell stories about where she had been. She did not need to. The hospital learned to listen faster, not perfectly, better. One night, long after the headlines faded and the calls stopped flooding the main line, Claire walked down the corridor toward Trauma 1 for a routine case. She passed the glass doors where months earlier the Marines had stormed in under rain and dust. For a moment, the fluorescent hum seemed louder. Claire paused just briefly and looked at the doors. Then she kept walking. Inside Trauma 1, a patient waited. The work waited. The kind of work that mattered because it was real and immediate and required steady hands. Claire pulled on gloves, checked the monitor, and spoke in a calm voice that did not belong to fear. "Hi," she said to the patient. "I am Claire. I am going to take care of you."